The Crohn's and Colitis Foundation of Canada is pleased to provide the new educational materials on this video. Whether you have Crohn's disease or ulcerative colitis, or have a friend or family member who does, we hope that our video series will help demystify these conditions. In this presentation, we explore nutrition as it relates to the diseases. Inflammatory bowel disease, or IBD, describes two similar yet distinct conditions, Crohn's disease and ulcerative colitis. They are chronic inflammatory disorders which can strike anyone, regardless of age, race, or gender. There's no known cause or cure for these painful and unpredictable diseases, but the CCFC is working hard to change that. We are a national volunteer-driven foundation that provides support through education, fellowship, and fundraising to find the cure for IBD. And we will find the cure for IBD. Each year we invest millions of dollars in world-class medical research initiatives to help us reach that goal. The Canadian medical, research, and health communities are key partners in our research and educational efforts.
In ulcerative colitis, you have inflammation of the large bowel only, so that you usually have a normal absorption of nutrients. While in Crohn's disease, you may have inflammation or complication that will affect the small bowel, and either due to narrowing of the small bowel or fistula or just inflammation, and this will affect the digestion and absorption of food. Both diseases will cause diarrhea, and therefore you may have losses of proteins, water, electrolytes. In ulcerative colitis, you have normal absorption of food in the small bowel, but the inflammation in the large bowel can create a lot of diarrhea and protein losses and blood loss that may impact on the state of nutrition. In Crohn's disease, because the inflammation affects the small bowel and can create complications like narrowing, fistula, it will also have an impact on nutrition by reducing absorption of nutrients like protein, energy, vitamins, and water and electrolytes. In Crohn's disease, good nutrition may improve disease activity. There's one study, for example, that compared patients who receive intravenous nutrition with oral food intake to patients with just intravenous nutrition. And both patients, because they improved their nutrition, also had improvement in their disease activity. So it seems to suggest that improving nutrition overall may improve disease activity.
The patient doesn't necessarily require a doctor's referral to see a dietitian. It's dependent on where the dietitian is based as to whether or not a patient requires the referral. Dietitians may be based in a hospital center, based in a healthcare center in the community, or based in private practice. Generally, a patient would require a doctor's referral to see a dietitian in a hospital or in a community healthcare center. For dietitians in private practice, generally, though, a referral is not required. If a patient wishes to see a dietitian in private practice, they may consult the Dietitians of Canada website, and the website address is www.dietitians, spelled with a T, .ca. What's important to keep in mind for all patients is that their dietitian and their gastroenterologist or physician communicate with each other to share health information so that both the patient, the dietitian, and the physician can work as a team. There's a number of nutrient deficiencies that you may be at risk for when one has inflammatory bowel disease. I'll give some examples. Energy is an important one. Protein is also important. And then there's a number of vitamins and minerals, including vitamin A, B12, C, D, E, folate, and the minerals iron, zinc, and selenium.
Well, there are two key areas of research right now in inflammatory bowel disease. One involves genetic research, and the other one involves the intestinal bacterial flora. In terms of the genetic research, the goal is really first to find genes that can be responsible for inflammatory bowel disease, and there were recent discoveries on certain genes predisposing to inflammatory bowel disease. In terms of intestinal bacterial flora, there is some research suggesting that by modifying this flora, you can actually modify the disease activity.
There are no hard and fast rules as to guidelines that patients with IBD can follow. But what we can say is that a patient should strive to eat a healthy, well-balanced diet, to be on guard if their appetite fails them or they experience food intolerances. There is no one diet for all patients with IBD. It's important that a patient understand which part of their bowel is affected by the disease and what kinds of complications they have. A patient should see a dietitian and spend time with their physician, understanding what a healthy diet is for them.
Tens of thousands of volunteers, members, donors, and sponsors across Canada are with us in our mission to find a cure. We hope you will become part of the CCFC team today. By volunteering your time, participating in our fundraising events, or making a donation, you will be contributing to research that is helping to find a cure. For more information, contact the CCFC at 1-800-387-1479, 416-929-0364 in Toronto and area, or visit our website at www.ccfc.ca. Help us find a cure.